In actual fact, atrial fibrillation that can be asymptomatic. So there's a significant amount of people walking around New Zealand who have got atrial fibrillation and don't know it. And it would be a great thing to do for people, especially over the age of 65, to have a chat with their GP and talk about atrial fibrillation and just make sure they haven't got it. The people who have got symptoms are likely to feel an irregularity to their heart rhythm. So they might take their pulse or feel their heart thumping and feel like it just isn't beating regularly, and those people should get checked out for AF. For people who've got AF, they might have been told they've got it after an ECG or a checkup at their doctor's or at the hospital, and yet they never knew they had it before, and they don't feel any different after they leave the hospital either. But all those people, whether they know they're in AF, so whether they've got symptoms or whether they haven't, whether they've got AF that's there all the time or whether they've got AF that comes and goes, everybody who's got AF is at risk of having heart failure over time, and especially of developing a stroke. So it's really important that people get checked out to make sure they're not in atrial fibrillation, and if they are, then they need to talk to their GP. But the difficulty about atrial fibrillation is that some of the symptoms are very common and commonly associated with other conditions that have nothing to do with atrial fibrillation. So people might feel more tired than usual. They might feel occasionally short of breath. They might feel a bit weak. They might feel like they can't walk up the stairs as well as they used to, and so on and so forth. And a lot of those might be caused by other reasons, and they might not even think about their heart or their heart rhythm as the reason for it. So it is difficult, and it's hard. It's a hard thing to ask people to check for at home. So it really comes down to people just being aware that if they've got any sort of odd symptom that they're not sure about, that they should really get checked out by their doctor.